I knew as early as 6th grade that I wanted to be a school counselor. I had some people in my life that were involved in the therapy field and had faced some adversity as a young child that drew me to that setting. I think becoming a school counselor has really opened my eyes to the barriers and the adversity kids face, so I just really want to help them overcome obstacles and empower them to do better.
Michelle Edwards is the reason why we have therapy here on site at Cardinal, which has been the biggest impact in the mental health arena. She came up with the idea, she connected with the external partners, she went to our superintendent and said, I want to make this happen. I think it's going to be really impactful for students.
The real challenge with being a rural school and not having those mental health supports is kids oftentimes would have to leave and be gone for 2 hours getting their therapy. And so Michelle worked with a community health center in Ottumwa to bring a full-time social worker that provides direct therapy to our school. She also partnered with Great Prairie AEA to bring in another social worker for 2 days a week.
The prior superintendent, Joel Pedersen, and I had worked hard to create kind of a pool of money for students to be able to utilize if they didn't have insurance. And then I work with American Home Finding Association to help the families get insured if that's a possibility.
Ultimately, she's the reason why students are missing less school. They're getting more resources provided to them here on site with their therapists, and we're able to keep them in class.
Screening has been pivotal in identifying kids at Cardinal. We have identified so many kids that we wouldn't have suspected that are struggling and able to get them services quicker, oftentimes at no cost to them. And their parents are so thankful that they were able to get resources and help for their child. Those things, they mean a lot and make a difference.
Michelle has been an integral part of improving mental health awareness in not only our school district, but also our community as a whole.
This is the 5th year that we have implemented Mental Health Awareness Week. Help reduce stigma that mental health creates and just have a lot of fun with different activities and people within the community. So the team usually takes the plan and divides it up amongst themed dress-up days, activities that the kids can do each day. There's usually a video clip for them to watch. We've done things like invited the local mayors from the towns surrounding the district to come and do a proclamation.
One of the most impactful projects that I think Michelle has led is getting a cohesive mental health team in our school district that works together as one to serve all the different tier systems that we have for our students.
Michelle normalizes all the supports that we provide here at the school, so they are just interwoven into the day, into the classroom, into every aspect of the students' lives. She is constantly and enthusiastically always looking for other ways to provide support. So she's grant writing or talking with other agencies around the community for their needs.
The best way to describe Michelle is relentless when it comes to mental health, and I just knew real quickly that I needed to get behind her because one way or the other it was going to happen at Cardinal. It goes above and beyond maybe what we should have to do at schools to her going and taking away every barrier for kids and families to get the mental health supports that they need.